you know, because I am a cardiologist, I'm an internist, and I'm a nutritionist. I said, if I can get you to be healthy without nursing home, without all of this, then I must, maybe I achieved something good. See how my hope was so low when I was in medical school, because all I see were nursing homes. All I see, everybody, I mean, these people work in this country, all this, build this beautiful country, and they cannot live past 80 unless they go to nursing homes. You know, and I came from Egypt. I didn't see a doctor until I was 27, and then lived longer. I said, something is wrong in this country. Then, of course, I found out that many things were wrong. Nutrition was wrong, toxicity was wrong, stress was wrong, and genetically all this affected that, and that's what we're going to be talking tonight. Let me see what's the title of the lecture tonight, because I didn't see it, I didn't look at it. That's the Spanish lecture I gave last week. So that's not, yeah, it's in Spanish, it was the same lecture in Spanish. Okay, let me see. You have the title of the lecture? Anybody have a flyer for it? You didn't have one? Okay. Well, I just speak about anything I want then. I just want to look at it. This is basically, heart disease. This is exactly what I had in my mind. Prevention of heart disease and diabetes and cancer. Thank you. So, for the new people, because most of you haven't heard me before, so I'm not going to ask how many people heard me, because only few have heard me. How many people have heard me before? Oh my gosh, we got over 15. Okay, that's great. At least I have 15 friends, and I'm going to make about 100 more new friends. My lectures, even I do have finished my PhDs in biochemistry of plants and nutrition, and then from there I went and done lots of research, then went to medicine, internal medicine, cardiology, and been practicing for 40 years. Still, my goal is to teach the public how to become nutritionists. 40 years I've been doing that. Try to teach people in English or Spanish or any language that how can you make a difference in your community, in your family, in your area. The TV is not going to do it. The newspaper is not going to do it. The doctor is not going to, the hospital is not going to do it. So what do the people need to do to build a great health and great business? You know, somebody asked me about a month ago, what would you do if you retire? I said, I'm not planning to retire, but if I would have retired, I would become a shotgun distributor, because I'm not. My daughter is. I buy from her. She makes lots of money out of me. Okay. However, I would become. But I told this to that person who was talking to me. I told him, but I'd be better than you, because you take your vitamins. I know all my patients very well. One of them sitting right there. But you don't share it with your neighborhood. You don't share it in your church. You don't share it in school. You don't share it. You're afraid to even talk about it. People might think you're a quack, or you try to make money out of them or something. I just want to tell you that the best thing you can give, the best thing you can give is good health. The three most important things in your life: God, your faith, your family, and your health. If you don't have your faith, you got nothing. If you don't have your family, you got nothing. If you don't have your health, what? You got nothing. Right or wrong? You're not taking it with you. But when I told Joyce if we can go up to 80, because her heart was not working very well that time, and I just saw another one of other patient body right there, so you know, then she is now close to 90 and working and acquiring new distributors, and that's exciting. Then with that all new great product check they have, we also have great diagnostic equipments nowadays in America better than we had 40 years ago. You follow me or no?
Yes.
We can see circulation inside the brain, in the heart, the kidney, in every place. We can see where it is missing, where it is down, where it is blocked, how much blockage, what to do about it nutritionally. You follow me or no? Once you improve the circulation of somebody and improve their nutrition, you're halfway there. You follow me or no? They asked me in medical school, what do you want to be? When I was in internal medicine, I said, I want to be internist because I know internists know the most about the body more than any other doctor. And I already have the degree on nutrition. So if I could become a cardiologist and improve the heart and the circulation, I think I'm going to be a very successful doctor. That's when I was in training, 1979, 1980, 81. Then I didn't go to oncology. I refused. I turned it down. Rheumatology, I turned it down. Surgery, I turned it down. And then when it came to cardiology, I said, I take that. Because they only were taking 2 people in the whole university for fellowship. I was one of them, another guy. So be lucky that you are chosen to select your own department is because they can see in you that you're going to be a good healer. You follow me or no? Professors can see that. They can see what time they check on you, what time in the morning you go to the hospital. Do you go at 9 or you go at 5 or 6? And I always went at 5, 6. So you are the first one there before even the patient wake up to check on them, and you are the last one to go home at 8 or 9 o'clock, so you be sure that, so they can see that, and when you're ready to, after 3 years of that, when they want to offer a position, they offer to these guys who serve. I remember one time, one of the departments I go through was lung specialty. And Dr. Bourrier was the head of that department. And he said to me, when I was going to training, he said, don't ever think, dream, you're going to get A in my department. Nobody gets A in my department. I know you've been getting A's in all these departments. You're not going to get A in my department. That's before we even started. Then, next morning, I went at 5 in the morning, really early, checked all the patients who cannot breathe under respirator, all the patients need help of that. And then I came to the office 5 minutes late, his office, with all the students. And it was a hot day in the VA hospital, and he had a white shirt, and I can see the redness coming through his shirt, his clothes, to his face when I walked in. I said, what's his problem? And I said, and he looked and said, Dr. Nasser, you're 5 minutes late. Let me tell you something. If you are a good doctor, and you work for a private hospital and you make lots of money, you will be here on time. But you are working with the government, so you don't care. You come 5 minutes late. He didn't even ask me how long I've been in the department, right? I told him, Dr. Boye, I appreciate if you want to talk to me alone. You don't talk to me in front of the students. And the redness went all the way up to here. And the guy was almost going to flare up. You just don't ever talk back to your professor. All it takes is a signature, and you're out of medicine permanently. Not out of school, out of medicine. That's it. His signature will destroy your career. So I said it anyway, and then we finished, and then I was making rounds, and I was coming this way, he was coming this way. He avoided me, he went to the right, and I went to the left, and I went to the right. Then I crossed. I told Dr. Bourrier, I apologize for answering back to you in front of the student, and he said, Dr. Nasser, I'm sorry, also I did that. And I got an A in that department. He knew I was there early. So tonight we're going to be talking about why do we need food supplements. This is just a picture of a lady right there to show you that healthy hair and skin and all that, it takes supplements, it takes lots of things to achieve health. But actually, I wanted you to understand, to achieve good health starts inside your mother when you're a baby. When you are infant inside the mother, and if that mother is not taking care of herself nutritionally, that baby will be born with a problem. Are you following me or no? Yes. Okay. So nutrition is something important during pregnancy and also during infant. When the kids are growing up, they need good nutrition. You heard about ADD, you heard about Ritalin, you heard about all these drugs, kids. They don't need any of that stuff. There is not a single child in my practice ever put on these drugs. Why? Because we depend on omega-3 and B complex and vitamin D and all this stuff in high amount to achieve good results with children in schools. I have received a family of 6 from Seattle. They flew all the way to Chicago because they don't feel good. What's your problem? We don't feel good. We heard about you. I said, you're going to come all the way from Seattle. You're going to rent a car, stay in a hotel, and spend all this money. I said, because we spend lots of money in our area and we're sick. So in any case, I look at their history. Each one of them taken at least 3 major drugs, psychiatric drugs. 3 psychiatric drugs. Within 2 weeks, we stopped 2.5 of the 3. Because you can't stop everything all of a sudden. But they were doing better, and when I called one of them is 22, the daughter, last night, was last night, she told me she already stopped taking half of the half, and now she's feeling so much better. And she doesn't need all these drugs. So we like to show you that the most important thing you have in your body is this one here, the cell. You see, the human life starts with a cell. The cell have hands. You see the hands? You see it, right? Those hands, when the food comes to the baby through a placenta, the food will have the nutrient, the protein, the carbohydrate, the fat, the vitamin, the water, the mineral, the oxygen, the hormones, all that stuff. You understand? And these cells, they're so complicated. So I'm going to put this baby aside and make a bigger one. The food will go inside, and the food get burned, and the cell will make its own nutrient. It's supposed, if it's an ovary, it's going to make hormones. If it's a brain, it's going to make a neurotransmitters. If it's a heart, it's going to make energy. If it's a liver, it's going to do detoxification. Are you following me, or going to sleep? Okay. So in any way, this food gets burned, produces energy, hormones, enzyme, plus what? Waste. It's the same thing I said 30 years ago. Exactly. And you said you did not forget. So if I cannot finish the lecture, she's going to come and finish the lecture. Okay. So this waste, she remember if I say these are called oxidant, and we have inside the cell B complex that works as antioxidant. and deliver it to another guy sits the other side. Give it to him. The chemical, the waste. And this guy is vitamin C. This guy here is vitamin E. This is omega-3 and this is B complex. You understand now? Okay, now, this, here he puts it outside. Another vitamin will come and grab it and take it outside. This is how we stay healthy. When we apply this principle to Shaklee people through practice, that you have good circulation and you have good supplements, all of that, people are living to be 80 and 90 and more. We have a patient who was 79 5 years ago, and I saw his wife 20 years earlier. She died with cancer. She was not my patient. He brought her in. It was too late. I said, there's nothing I can do for her. And then she died. And then he brought his daughter 2 years later, 26, with same cancer. And she also was too late. These were not my patient. So he became my patient 20 years ago. And he went checkup every year, all the time. Checkup for cancer, checkup, checkup, checkup. And one day, 5 years ago, I discovered he had cancer. He was 79. I told him I could cure that cancer with little treatment and with 100% success. This was a prostate cancer. He got excited. We did. Then after he was cured, I told him, Ken, I want to give you good news. The good news, you have no cancer anymore. The bad news, you're not married. You live alone. So I did save your nerve for urine, your nerve for ejaculation, or your nerve to go to the toilet. Okay, 3 nerves go through that area. So I saved 3 of them. So one of them you need to get married to use. So he said, I have nobody. I said, I know somebody. Then I fly a lot to California, and I met this flight attendant named Paulette, which we knew each other for many years. You know, we talk all the time about nutrition. And she told me she had problems with her family and abusive husband and abusive family and divorce and all this stuff. And she was like 56 or so. I said, I feel really bad for her that she's not happy with her family. So I introduced them to each other in a lecture like this. I said, Ken, you come sit right here. This is Paulette. This is now you know each other in front of them. Introduce them. Now they've been married 5 years. They travel around the world. He's 85, and she's 56 or 57. You follow me? When you have your health, you got everything. Another example to some of you. These examples are important to all of you. Why example? Because when you introduce Shaklee product to people who are like 80 or 90, they're going to tell you, I'm too old for that. I'm over the hill. I don't need it anymore. You follow me or no? When you give them hope, which is in the tape, or I say it in the lecture, then you give them hope. That means a lot. Hope you can take away from people. We need that. This was a man, his name is Ed Kimnick, you know, you're Ed, right? And he brought his wife. They were my patient 20 years ago, and she came with congestive heart failure. Very advanced in January. I told him I'd do the best I can, but could not save her life. She died by February. Then he came in March, and he's still farming, and he's 91, and he lost almost 40 pounds in 1 month. Guess why did he lose it from? What do you think? Huh?
Broken heart.
Broken heart. Depression. I said, Ed, why did you lose weight? He said, broken heart. That's what she said. I said, do you believe in God? He said, absolutely. He's a Catholic. I said, what you're doing is against God's law. You're refusing to eat. You miss her, that's true, but you didn't create her. You didn't take her. You don't even have a guarantee you're going to be around tomorrow yourself. So you got to love her. You love her, but you got to continue life. How do you tell 91 to continue life? Then you have to shock them. He weighs 90 pounds, 80 pounds. He was 130 before. So I have to tell him, you got 3 choices. Die, go to nursing home, or get married. You can't say to a person, you know, because I don't believe in dating, I believe in marriage. You know, this is God's law, is marriage. So I told him, if you have somebody in the home, a woman, it has to be your wife. Because I was planning to get his hormones active and take care of him and make him healthy and all of that. So in any case, he came a month later with an 87 years old woman that they're going to get married. When did they get married? April or 25th, something
April
like that?
25th, yeah.
Now, you have 91 made to 87. Why didn't I tell him, you know what the hell, you're going to die? And this, because this is hope you don't take away from people. You follow me? So I'm giving you right now is hope that you are so young that you have all life ahead of you. Not only Shaklee is a great product, we have also a diagnostic tools. We can discover cancer 2-3 years ahead. Stroke 2-3 years ahead. Osteoporosis 2-3 years ahead. We have the thing. And also Medicare happened so far covers 100% of diagnostic tests for Medicare patients. So far. And we don't know what's going to happen next year or the year after or the year after. I believe we as doctors are going to fight very hard for the senior citizens that the Medicare is not going to be touched. We're going to fight. I don't care which party is going to win. Nobody's going to touch the Social Security check and that Medicare benefit to those people who work all their life. You follow me or no? As a doctor, that's something I got so excited when I became on Medicare at 65. Finally, I can have everything I want. Check my heart, check for cancer, do this and this and that, without worrying how much money I'm going to pay the insurance and this and that. So my Medicare patients are the healthiest patients. My non-Medicare patients are the sick patients. Why? They have no insurance. They cannot afford it. Every test you want to do, the insurance wants 40% and you pay that. People cannot afford that. So if any of you are Medicare, you have my number, you call me, myself, on my cell phone, which you have it in that article I gave you, which I'm going to give it to you in the end. Then you call me, see if I can help you to check your circulation, your hormones, your everything, your vitamins, even the cover magnesium, manganese, nutrition, vitamin D, vitamin K, all the stuff. We can do $30,000 worth of testing to Medicare, and they still pay for it. They don't pay me, they pay the labs. Why? Because they believe in preventive medicine. The insurance company don't, but Medicare does. So I want you to put that in your hand. Don't ever let any party or a politician make us lose Medicare if you are on Medicare or going to Medicare. Because it's your money. You deserve it. It's your right. You work so hard for it. You follow me? If somebody say, oh, we're going to take this money and we're going to lend it to AIG or lend it to this company, to Bank of America, we're going to lend it so they can invest. We don't want nobody to invest for us anymore. You follow me or no? These people will just invest it on their own. Look at that guy, what's his name, that stole $5 billion or something.
Bernie Madoff.
$50 billion, you know? If I'm going to steal, I steal $20 or $30 to eat. But $50 billion? Because when you have no fear of God, no fear of nothing, you can do what you want. $50 billion, how many families he destroyed? And is he in jail? He is not. They say he's in jail. I don't believe it. I believe they enjoy their money very well. So in any case, after we achieved the success with Shaklee people to live up to 91, 92, 93, 97, now we have came out with a new technology from Harvard Medical School, went to China, and it came back to us. They developed a new machine. It took took 49 years to develop between China and the United States that can rebuild new circulation in the heart, new circulation in the brain, new circulation in the kidney, new circulation in the legs, in the body, and Medicare covers for free. So that itself will add another 20, 30 years to the life of this people. So we expect people who are shackling, who take care of their circulation and their hormone nutrition to be 110, 120, 130 without being in nursing home, like turning right and left like this. You understand? Nobody wants to die like this. So this is the problem we're going to talk about right here today, is why do we have cancer? Why do we have poor circulation? What happened? The reason behind that is very, very simple. Let us get to the root of our problems. The root of the problem started 1800. What do I mean? Cancer started about 1800. Heart disease, diabetes, depression, psychiatric problems, you name it, starting around 1800. Is this means before 1800 we were perfect? And we were not perfect, but we did not have the killer diseases that we have now. You understand? I'm sure somebody had a back pain, somebody had arthritis, but we were not like this. Before 1800, how long since Adam until 1800, year 1800? Let's say 20,000 years. 20,000 years without doctors. We did well. You're talking to a guy who came from a country, my village is 20,000 years old in Egypt. That everybody been there since the beginning of time. You follow me or no? We never saw a doctor in the village, never. Never see somebody came and take the blood pressure, did a blood test, did a urine test. We have problems. We have diarrhea, we have nausea, vomiting, parasites, but we treat it with herbs and vitamins. We know how to take care of it over the years. So what happened in 1800? 1800 was the year that we separated the white flour from the whole wheat flour. That's when both Bitter brothers, they developed the mill that we have white bread. Why is that bad? Because if you eat whole wheat or whole oats, it takes 6 hours to digest. And you only can absorb 30% of the starches of it to sugar. Starch breaks down to sugar, but slowly. The white flour takes 1 hour to digest. You follow me? So if you look at the digestive system, here is your mouth someplace right here. This is your stomach, and your intestine right here, and the liver is right here. What happened? We eat, we get digestion, right? Then we get what? Absorption. Then we get in the liver detox. Then we have circulation, right or wrong? So what happened here, why I'm saying 1800? Because the way men and women on this earth ate, they ate natural stuff all the time. They ate a fruit, but they didn't have fruit juice or sugar. They ate whole wheat, but they didn't eat white bread. Technology was not there. Industrial revolution was not there. You follow me or no? So here, when we eat the whole wheat stuff, it takes 6 hours to digest. And this digests to sugar, and it enters, something make a noise. Oh. Okay. Anyway, drug companies, I think they're listening. So the sugar enters slowly. Then you have energy all day. Now let me change it. Let me feed you white bread. and it takes 1 hour to get to the liver. Which one putting more sugar in the liver? The white bread or the whole wheat?
White.
The white. That's called the sugar load, right? Most of you know more nutrition than most of doctors. Okay? So I have lots of confidence you know all the answers I'm going to ask tonight. So the sugar load is increased. Are you following me? Is that bad or good?
Bad.
Very bad. Why the liver doesn't like sugar? Because nobody likes sugar. The brain doesn't like sugar. Too much sugar I'm talking about. The heart doesn't like sugar. Every part of the body likes sugar, but up to small quantity. Not over that, not under that. Okay. So in any case, the amount of sugar that going in the liver is increased tremendously. So what happened? The liver gets in trouble. Have a problem. Look at this. Here it is. Okay. Now that's the year 1800. Watch what happened, because I want you to be a statistic like me. You know, I want you to. By 1870, we discovered the mill. Now we can make sugar and juices. We don't have to eat fruits. So we have corn syrup, we have sugar, we have that. Now go back to this guy again. If I ate an apple, how long it takes to digest the apple? 3-4 hours with the sugar in it. What happens if I take the apple and put it in juice? How long that enter the liver? Faster or slower? In 5 minutes. 3 hours versus 5 minutes. 6 hours versus 1 hour. There is more sugar load. You follow me or no? Now you get in the idea, because once you get to the root of the problems, then you can solve the problems. You follow me or no?
Right.
You know, we don't do miracles in our clinic. Only God heals people. But if we use knowledge properly and change people's diet and vitamins, that we have better results. So 1870 we had a problem. How do I know that? Because 1800 we checked the sailors navigating the world. We find out there's a complaint started 1805 of thirst and too much urine. The disease called what? Diabetes, polyuria, polydipsia. By 1870 there were more complaints. Fatigue and this and that. So what happened here in 1870, the doctors started tasting the urine of the sailors. Every sailor passes, gets some urine. The doctor put his tongue in it. If it's sweet, he said, no, stay home. Next. That's in America. Last year, I was giving a lecture in Milwaukee, and a doctor from China was sitting. She said, in China, in 1870, we didn't do it that way. We put the urine on the ground. If the ants come to it, there is diabetes. And then if the ant doesn't come, then that person's good. You follow me?
Yeah.
This is all the diagnosis test 1870. By 1970, more sugar, fructose, was introduced. You know that fructose is very powerful sugar. Coca-Cola, Pepsi-Cola, soft drinks. It's very powerful sugar. So if you have that much sugar going through the liver, what do you think the liver will do with it? How big is the liver in it? Very big. From this side to this side. And this big. You follow me? How big is the heart? This size. The brain, this size. So the liver does a lot of things. detoxification, clearing, amino acid, hormones, this sits right here. Everything you eat has to go through that liver. Thank God that we have a liver. The liver, when you see the sugar, what does it do? It converted to homocysteine. Can you hear me in the back? Can you hear me without a microphone?
Yeah.
Okay. I can turn the volume on. Okay. So it makes homocysteine out of sugar. The liver says, I don't care if the homocysteine is poison, I don't want the sugar. Then the homocysteine is like crazy glue. It goes around and clogs everything. It goes around this cell and cover the hands right here. You understand?
Yeah.
So, is that good or bad?
Yeah.
Because the amount of food you have in the blood is good. You have vitamins, you have minerals, you have food. But how much is going inside? It went down, right? So that's why we have, if you're diabetic, your blood sugar right here outside is low or high? High. Let's say 300. The blood sugar inside how much? Maybe 20. You follow me? So you're diabetic, you have sugar, but you don't have the energy. Why? Because you can't burn it. That is called insulin resistance, and that's a problem of the homocysteine. That's just one problem. Then the liver will convert another group of sugar to triglycerides and put it around the waist, and they're called central obesity, and convert some to cholesterol, and convert some to growth hormones. Have you ever heard about growth hormone? Growth hormones is good to have when you're a child, to have a growth hormone to grow. But it's not good to have too much of it, because you will grow too fast. So what happened when the kids ate lots of sugar, and their mothers and father, all that, what happened, they grow faster. So the girls, they used to have their menarche at 15, now they have it at 11. Because the ovary is growing fast. And the prostate starts growing bigger, and the polyps, and the skin tags, and the breast, and ovaries, and cancer. Growth hormone lead to cancer. You understand so far? One problem, the sugar, lead to all of that. So by changing the diet of a person, to cut down the white bread and carbohydrate and white bread and sugar and all that, and increase the fruits, we benefited that person. Because the homocysteine will go around and will cover the cells. When it covers the cells, what does it do? What does it do to, let's say, this is a picture of a guy right here. His bones will have bad cells, so he's going to have osteoporosis. His intestine will have a problem. His heart will have a problem. His muscle will have a problem. You follow me or no? So we can go on and on and on and show you a picture of the human body, but it all goes back to the basics. Circulation will be clogged. And we have a picture right here of the cell. I like you to see that because it's a really neat picture, and it's a real picture either way. This is a picture of the same cell I was talking about before, but it's more detailed. You see the hands right there? Everybody can see. Can you see it in the back? Okay. These are the omega-3. And the B complex and all the antioxidants work inside here. Can you see the red spots? Can you see the red spots from the back? You see, these are the toxins. So what happened to a healthy cell? It gathered the toxins and put it in a container. You see that container right here? You see that? And then secreted where? In the bloodstream. See how easy the body detoxifies itself? All of these, the vitamins, minerals gets involved in that. Every nutrient gets involved in that. I will show you a bigger picture right here. For the people in the back, you can see. You see the detoxification, right? So medicine is science. And if we can prevent these hands from being full of sludge around it, and the arteries and the cells, then we're going to have better results. It is a good idea to eat good food. There's no doubt about it. However, this is your problem. Your disease process, heart or cancer or anything, start with poor nutrition, or stress, or toxins, or genetic. You follow me so far or no? Yeah. And then if you, I think I might have one article right here from my magazine. I started a new book, and here it is. And I'm sending it for free to people. Anybody receive my magazine in this room? Somebody must have received one of those. Chris, you didn't get one? You didn't? Okay. Well, that means we don't have the address of everybody. But in any case, this, if you leave your name, it's your responsibility to do it. In front of me here, I will send it to you free of charge. I send you one every 2 months for the next 6 years. We will cover every nutrient. All the stuff I'm talking about is covered right here. And no advertisement, nothing to sell, no membership, nothing. You're going to get it for free. On papers, not emails. So when you write down, write your address and your name and everything, because I don't email anybody. Because you know why? Because people don't read the email. I'm not going to do 8 pages of nutrition here and make curves like this and all of that and have somebody scan it and just erase it in his phone now. Tell him get lost. You don't belong to me. You have to take the time and read it. I asked for the people, I did ask for the people who received 700, he told me 700. I asked him, what do you think? Because it's my language, it's my curves, everything. He said, just like the lecture exactly. Perfect. So if you take that and add to it your Shaklee advertisement, your own Shaklee newsletter to it, there's no patent here. You can send it to 100 people, 200 people. You follow me or no? Then your business will grow. People will buy your product if they know why. Scientifically why. Because everybody competes in business. Health food stores say, my product is the best. Relive said, our product is good. And New Life said, product is good. You follow me or not? Yeah. There's no product in the world better than Shaklee. However, people need to know that from a scientist who does not work for Shaklee. Which you mean? I'm a scientist, been for 40 years. I use the product, my family use product, but I am not a distributor because I was accused long time ago, 40 years ago. I'm saying these things because I'm a coordinator, which I was. Then I resigned next day when I was second year in medical school. I said, don't accuse me. I'm telling the truth. I don't have to say Shaklee is the best because I need your $5 or $6. But the insult was there from a doctor in Salt Lake City in a big lecture, 2,000 people. If you know Naomi Cranney, right? You know her. She was putting the lecture on. And this guy, he's a doctor, stood up. He said, well, you're saying this thing about Shaklee because you sell it. I said, it's true, I sell it, but it's the best. He said, no. The next day, I resigned. And I still lecture 4 times a year on it and practice it in my practice. So this here magazine, you will get it if I have the information about you here. The paper you received right here, we're going to read that later on. We haven't started the lecture yet. So by tomorrow morning, by 4 o'clock in the morning, we'll read it, okay? Tomorrow's Sunday, I don't have to work. And there is no snow, so I'm going to enjoy my ride to Chicago. It doesn't matter what time. I put my speedometer exactly at 65 or 55, and I stay in the right lane until I get where I'm going. And I pray all the time, and I said, okay, I don't have to worry about a policeman, I don't have to save 5 minutes, I don't have to do all of that, and you should do that also. But in any case, this is what causes disease. You follow me?
Doctor?
Yes.
Well, it's stress, poor nutrition, and what?
Poor nutrition, stress, toxicity, and genetic. But you get it in the paper if you put your name. It's right here, okay? But let me go over the nutrition fast because I don't want to waste lots of time here. You guys, I know Shaklee people for a long time, so I know how knowledgeable they are. I want to give you the information that you can use to sell your products and use it also. You follow me or no? And there's a gentleman who recorded it right there. You can borrow it from him or pay him $100 per tape. No, he doesn't want to get involved with that. He do it for himself.
Battery died.
Your battery died. Well, needs Vivix. Okay. Hey, my nephew battery didn't die yet. But it doesn't really matter. It doesn't matter. These lectures, it is going to be, I think your mother going to put it on YouTube or somebody going to do YouTube. They're going to put all my lectures something called YouTube. I don't know, have no idea what YouTube is. But all these lectures, they gathered everything and they put it in something called YouTube. In any case, you can find all the information that use it. And in nutrition, people ate the wrong protein for 200 years. There is vegetable protein, animal protein. Which one you think is better? And people were eating animal. So carbohydrate. There is complex carbohydrate and white bread and sugar. Which one is better? Complex carbohydrate. And fat. There is polyunsaturated fatty acids, olive oils and all of that. And there is lard. And which one is better? Olive oil. And what people eat. You know what they eat. So you can really go through vitamins. There's no vitamin. There's 99% of vitamins not even in the food we eat. Did you know I was arrested in 1972 in Richland Center, Wisconsin, for saying that adding hormones to the cows can hurt us, and DDT can hurt the people. And for that I was arrested, and they erased it. They dropped it after giving me a hard time for 5 years. Wow. My citizenship was put a hold on 5 years because I said that until people told me what they did is wrong, and then the judge said to me, we want you to come to representative to sign paper that we drop the case. When I got in front of the judge, I told him, I don't want to drop the case. He said, I'm the judge, I'm dropping the case. I said, no, I don't want to drop the case. I committed a crime, I have to pay penalty. And he doesn't understand where I'm coming from. He said, Your Honor, you said I'm not supposed to say vitamin E is good. Vitamin B is good. That organic food is good. DDT is bad. Hormone is bad, right? He said, right. I said, right. Put it right there in the writing, and I sign and you sign. Then I carried it with me. Got a lawyer. They dropped the case. And when I get in my citizenship, the judge asked me, have you been arrested? I told him, yep, I have. Then he said, he looked at the computer, he said, no, you have not. I said, yes, I have. I got it out. I said, read it. And he said, oh, those bastards, they erased it from your record. There's not even a record of you being arrested. I told you, Your Honor, Satan is very strong. They can do whatever he wants. But God is stronger than Satan. Amen. So in any case, they were upset that I said we need vitamin supplements. We need vitamin supplements. We're going to say that tonight about how vitamin B complex, how important it is, and all these vitamins in circulation. And I'm going to, when I have the time, I'm going to have my granddaughter read it, so you can read it with her when we have the time, because if we have the time, we'll do it. If we don't, we're not going to do it tonight. You can read it on your own, okay? So in any case, mineral also is low. Do you know why mineral are low? Just anybody can give me an idea why the food doesn't have enough minerals. Yes, sir?
Not in the soil.
That's right. I'm a farmer. If we don't put it back in the soil, it's not going to come by itself. I have a horse farm. I've been farming for over 20 years. What do we do? What do we do with the manure? Because you work on the farm. We put it back in the field, in the alfalfa field. So what happened? We have organic fertilization. And also inexpensive. Okay? So minerals are missing, you're right. And vitamins are missing because minerals are missing. And water. Do we drink enough water? People drink Coke and Pepsi and beer and all of that stuff. What happened to water? The last thing I heard about water, there was an ad on TV. Have you ever seen this ad on TV about 20 years ago? I'm going to check your memory now. The guy walking in the desert and was so thirsty, and somebody gave him a glass of water. He said, no, I don't want that. I want a straw beer. If anybody remember that? Raise your hand if you remember that. So you can imagine my own government telling my kids, if you're thirsty, don't drink cold water, drink straw beer. You follow me or no? Because don't be stupid. You're smart and you know these ads are directed toward the kids, not toward us. They want a generation grown up drinking Pepsi and Coke and this and this and this and this. You know, I saw that in the Korean Olympic advertised for Coke. The woman sitting in the end, or a guy sitting in the end, and a woman was swimming in the water, and she came out on the other end with a bottle of Coke. Go like this. If you're thirsty, why didn't you drink when you're in the pool? You know, it has water in it, but it's all about getting the brain ready. What you're going to buy when you make a decision, it's always soft drinks, or beer, or this or that. Even beer. I'm not against beer without alcohol. You can have beer. Beer has hops. Hops is good for you. Hops is good for the heart. Hops calms you down. But it doesn't have to have alcohol. You follow me or no? Do you know that people get drunk from beer? They get drunk from the hops, not from the alcohol? The hops is very, like valerian, the hops is so calming. It's just terrible if you get it by itself and make a tea out of it. It's just very bitter. But if you get it in non-alcoholic drinks, it's very soothing and calming. You follow me or no? Okay. So in any case, this problem with poor nutrition causes disease. The problem with stress causes disease. Stress. Do we have stress? No? Okay. You must be from another planet. Of course we have stress. But you know what? 90% of the stress is self-induced. 10% from other people. This is the fact. If you're healthy, perfect health, stress is not going to bother you. If you take a mother with her baby, she's stressed, and the baby running all over the place have no stress. Right? Because whenever he wants the food, he got it. He doesn't have to worry. You follow me? Stress burns B complex, burn the calcium, burn magnesium, burn things. So people who have good nutrition, they tolerate stress better. So nutrition is good against stress. Right or wrong? B complex, calcium, all the stuff you know. Another thing is good is exercise. You can't have two stresses, running on a treadmill and somebody giving you bad news. Because you barely can make it on the treadmill, you're going to drop dead. And somebody tell you, I lost my husband. I said, I don't care, I'm going to drop dead. So stress test, what it does on the treadmill, it forces you to bring the stress to the muscles rather than the brain. You follow me? Because you can't have brain stress when you're running the treadmill. If you're shoveling snow and you have puffing and puffing like this, you think you have stress from the car is not going to start or you don't have money? No, you want to make it to the end of the driveway before you freeze. So stress is good against, exercise is good against stress. Praying or meditation, praying is also good. Somebody believe there is a God going to help them during stress, they will get the help. You follow me or no? And we're becoming a godless society in many ways. By name we are. We think we believe. But action does not speak. We don't see it in action. We see people yelling at the highway. We see swearing, giving fingers, doing this, beating their wives, killing kids, all that. What kind of believers are that? You know, if you're doing all of that. Your action has to speak what your heart say. So in any case, the last thing is toxicity. We have too much toxins in society. We have detoxified the air, water. This is the causes of disease. So when we talk about really the causes of our disease, we'll find out I wanted you to you have an article like this. I want you to read a little bit about homocysteine. And I'm going to ask Medina to come and speak loud and slowly. Because she speaks. Does she need the microphone?
Just give her the mic.
Is there any more of them?
Any more of what? Of those?
Yeah.
We'll get you more. I think you have. Let me see. The first 3 pages, for 3 pages I have extra. The last 2 pages I don't have enough. Does anybody need the first 3 pages? We're going to start with the first 3 pages. You need more? Okay, let me see if I have any more right here. Okay, 1.
A brief overview of methylation and homocysteine. The purpose of
Louder.
Louder. Okay.
What page is that now? Cover.
The cover.
Oh, thank you.
The cover page. Let me put it right here. See, maybe for the people in the back and the purpose of this paper. And I wrote down. Thank you. Stay with me here. I wrote down the purpose of that. Right in this paper is to serve to advocate people about the role of proper nutrition and exercise and health. Number 2, to help identify risk factors. And number 3, to report, supply the majority of the relevant reference of the medical literature. So what I'm saying is educate you, and I'm going to give you scientific papers published about the information we're going to say tonight. You understand? And she's going to read from right here about the homocysteine. I'm going to put that page. Yeah, just 1 second. Right here. Let me see. Okay. Let me just have a paper right here. What's that? Okay. All right. She's going to talk about this. Is what's a homocysteine and why homocysteine is not recognized. I'm the only doctor who treats dissolved homocysteine in the world. Even many doctors before me did, but nobody wants to address it because it has direct connection with nutrition. Okay, so you go ahead and just read it, and then if you don't, then I will read it myself.
Homocysteine is a toxic amino acid that is present in everyone. As a non-essential amino acid, the research of homocysteine got off to a late start, beginning in earnest only in the 1960s. Several cases of children dying of vascular damage, usually reserved for older people, were noted in the medical literature. In 1968 to 1969, Dr. Kilmer McCulley studied the cases and noted that the only known problem was a genetic defect in the children's ability to lower homocysteine. He theorized that homocysteine must be able to cause vascular disease and give the weakness in the current theories, proposed homocysteine as a cause of vascular disease in the general population. Dr. McCulley performed a variety of animal experiments confirming his hypothesis, but it would take a large-scale human epidemiological study before his hypothesis would be accepted. That study was finally completed in 1994 and published in the Journal of the American Medical Association, authored by another Harvard researcher, Dr. Meir Stanford. Now homocysteine is the most talked about risk factor for vascular disease. With proper nutritional supplementation, nearly all causes of elevated homocysteine can be resolved and dramatically improved. Even though homocysteine's role in heart and vascular disease has now been accepted, the field is still in its infancy. Homocysteine can be found in several different forms in the blood. Homocysteine seems to increase the damaging effects of fibrinogen and lipoprotein A, thereby increasing clotting while decreasing the ability of the blood vessels to contract and expand. These damaging effects appear to be separate from the direct damage to the blood vessels by the irritant homocysteine. While there is a considerable amount we do not know about homocysteine, we do know how to use nutritional supplements to reduce homocysteine levels. This is done through 3 independent routes. 1, using folic acid with vitamin B12. 2, using trimethylglycide. Glycine. 3 through B6. The first 2 are called methylation, and the last is called transsulfuration. Methylation is a process of putting a methyl group, 1 carbon atom and 3 hydrogen atoms, on proteins, enzymes, chemicals, DNA, or amino acids like homocysteine. When a methyl group is transferred from folic acid to homocysteine, the homocysteine is converted to the essential amino acid methionine. This process of methylation results in lower homocysteine and an increase in methionine. Both folic acid and TMG have been used for nearly 2 decades to lower homocysteine. These 2 pathways are independent. Some people are better at using TMG to lower homocysteine, and others better at utilizing folic acid. Folic acid requires B12 for this activity. Such a combined approach in conjunction with vitamin B6 can normalize homocysteine in 95% of the people studied. Vitamin B6 and transsulfuration. The remaining method of lowering homocysteine is through a process using vitamin B6. This is a separation process from methylation. Using B6, the cells convert homocysteine to cysteine. This important method of lowering homocysteine is particularly relevant in the U.S. because B6 is very unstable, and in today's diet of processed foods, B6 is destroyed and usually needs to be supplemented. Methylation beyond its role in homocysteine. Methylation is a process necessary for many biological functions aside from homocysteine. Methylation is involved in maintaining DNA.
Okay, wait right here. The word methylation, she's talking about homocysteine, we can dissolve it. We find out that every cell in the body uses all the vitamins to do methylation. Methylation is adding and subtracting, detoxifying the body. The liver does that. So she's saying, beside the homocysteine, it does DNA integrity, processing fat, improving neurological function, detoxifying the liver, connected to every biochemical process in the body, and so on, so on, so on. So it's saying that taking vitamins, this is science. If you look underneath right here, all these papers, they're not from the National Enquirer. This is from real magazines, you know, that doctors use. I mean, so here we try to prove to you nutrition is science. Shaklee is real, it's science. Okay, she's going to just go ahead and start in this one right here.
Vitamins closely linked. Recent studies in the UK and Norway of people 65 years and older and of young people ages 4 to 8 found that plasma homocysteine levels increase progressively with age and are directly related to plasma levels of folate and vitamins B12 and B6. The lower the vitamin B levels, the higher was the homocysteine concentrations. In July 2003, in the UK, in a randomized study, 353 patients received high daily doses of folic acid, vitamin B6, and vitamin B12, while 353 patients received a placebo. 3 months later, the vitamin supplemented group had a 30 to 40% decrease in homocysteine levels compared to patients on placebo. High homocysteine.
And how much time is that? In 3 months, you said? In 3 months. 3 months, 40% improvement in circulation. That is good information. You follow me or no? Yeah. Okay, go ahead.
High homocysteine implicated in dementia. The association between high levels of homocysteine and dementia, including Alzheimer's disease, has been observed in epidemiological studies and confirmed in case control studies in which patients with vascular dementia and Alzheimer's disease had higher levels of homocysteine than did healthy people. A direct link between increases in plasma homocysteine and loss of cognition was shown by Sachardi et al. At Boston University School of Medicine and reported in the New England Journal of Medicine, February 14, 2002. Framingham Heart Study provides compelling evidence that in adults with intact cognition, an elevation in plasma homocysteine over time is associated with an increased incidence of dementia, including Alzheimer's disease. Summary: lowering homocysteine lowers dementia risk. Elevated plasma homocysteine is a major risk factor for dementia, including Alzheimer's disease. Hyperhomocysteinemia commonly results from a deficiency in folate and vitamins B6 and B12. Antioxidant levels decline as a result of normal aging and dementia, increasing your intake of vitamin C and E, along with photochemicals.
Phytochemicals, Vivix, by the way.
How hyperhomocysteinemia leads to dementia. Vascular effects. The Nunn study of aging and Alzheimer's disease, dementia found in worsening of dementia where areas of dead tissue were present in the brain, indicating that homocysteine contributes to dementia by inducing vascular changes that result in insufficient blood flow to the brain and cell death. DNA damage and cell death. Other events contribute to neuronal health, cell death by homocysteine. Experiments in cell structure show that homocysteine can directly kill neurons in the hippocampus, the area of the brain associated with memory.
Thank you. Good job. First time she ever done that, and I had to tell her, you're going to do fine, and these people are friendly people. Okay.
Congratulations, you're now signed up for the next 6 years of lectures.
Okay, now what I like to summarize what I said, the information we gave you tonight on nutrition, we backed it up by scientific research, that you have it in your hand, that you can check all the papers. And also, if you leave your name for me, we will give you this is what the article is going to look like, and the curves that I drew, I did it with, by hands myself, because the computer could not do what I did. So I am glad. So my patient actually asked him, how did you like this? He said, I was worried maybe somebody else is writing it, but it sounds like you, because all the mistakes in English, it's yours, it belongs to you. So this is good. This is stuff you can add to it. You can say, so-and-so newsletter. You can say, Dr. Nasser said that. You can add your products in the back. You can talk about. Another thing is very, very important. I want you to know, for cognition, vitamin D, which you had somebody here was lecturing on vitamin D a few days, last week or something like that, right? Somebody was giving a lecture on vitamin D from Shackley, right? Master coordinator. That happened or you know it didn't happen? Okay. Anyway, I got a call from a master coordinator in Shackley who have lots of people. He said, would you please mention something about vitamin D tonight? Okay, vitamin D is, we've been using vitamin D in large amount between 2,000 milligrams a day to 60,000. What do we use it for? We use the low dose, we use it for depression, for osteoporosis, for Alzheimer. The high dose we use for cancer. The only treatment we can use for cancer of the bone is vitamin D. So vitamin D is used by urologists in prostate cancer. There's no other treatment. Multiple myeloma patients, bone cancer. So vitamin D is very, very important, and I made a promise for that to mention that tonight. The second thing I want to mention, there are magazines like this we are associated with. This is American Journal of Medicine, and from September 26, 1994, to tell us antioxidant against cancer, ROS against with vitamins, antioxidant for heart, and this is from Harvard University and other schools. Are you following me or no?
Yes.
So the information we put here is scientific. One of the things very impressive I wanted to share with you is this part of the paper I just put. Is it upside down? Okay, good. Okay, here is what I wanted. I know you understand that, but if I simplify. This right here is the cell. Okay? This here, the environment. Let me put it up right here. So when the cell gets exposed to pesticides and ozone and all this problem, the antioxidants get rid of it, if you have it. If you don't have enough antioxidants, it will go inside what? The cell, to the nucleus, to the what? The DNA. And damage the DNA. Lead to what? Aging, arteriosclerosis, cancer, cataract, so on. So why am I putting this there? You know it already. No, there is another part of the paper you don't know, which I'm going to bring it down right here. My doctorate degree, my research I done in Egypt, 1963, 1964, 65, it was about what's in Vivix. Vivix is bioflavonoids. And my PhD was about bioflavonoids. But that time, 1963, I was one of the few people in the world to say that bioflavonoids actually can go inside the nucleus and repair the damaged DNA. So I had no proof of that since I left Egypt 68, I'm sorry, until 1996 when Harvard published it in their study right here, and I want to show you this one right there. And then I'm going to read it with you. There are a number of DNA repair enzymes. Have you ever heard that there is an enzyme in the nucleus can correct the damaged DNA you inherited from your father? Have you ever heard about that? No. Now we have a paper published in 1996 in Harvard. It says there are number, my days were only one, DNA repair enzymes, such as exonucleosis, that's enzymes. Enases means enzyme. And endonucleases. And specific glycolases. means enzyme. 3 types of enzyme, look, that can remove the damaged DNA, remove the lesion. You know, when the DNA gets damaged, mutated by radiation or something, it will remove that and repair it. However, the repair system, not perfect, but 99% perfect. You see that, or you need my glasses? Okay. Right here, I think you can see it. 99%. And the 1%, so we have all kind of science to prove that the problem that's bothering us in society, killing us, like arteries, they're being clogged by triglyceride, by homocysteine, by low omega-3, elevated C-reactive protein, excess LDL, excess insulin, low HDL, high sugar, low nitric acid, insufficient vitamin D, oxidized, all of this lead to heart circulation problems. You understand? And this is all reversible, not with drugs, with nutrition. Then we go to syndrome X itself, and that is a skinny guy right here in front of you. This is a person who's fat, and there are 27 different reasons. I mentioned syndrome X. It's all behind, the sugar is behind all of those. This will lead to inflammation. You know what inflammation is? When the body is inflamed, means you have a headache, you have aches, you have fatigue, fibromyalgia, you name it. You will develop cancer, heart attack, Alzheimer's, this and this and this, all related to nutrition. You want a picture of arteries that's clogged? Here is, I want to teach you something that you don't know. This is a perfect artery. Can you see that on the right? I want you to look at the left, right here. This artery here has blockage, right? You see the yellow stuff. This artery, does it have blockage inside? Yes or no? No. But what does it have? The same amount of blockage. What does it have? He just said it. Because it has arteriosclerosis. Then when you go to a doctor with chest pain or check you, he said, we did an angiogram and there's no blockage. Then you go home, you drop dead. Right? Because he didn't realize that this deposits here in the cell needed B complex. You need to remove the homocysteine. You need the C, you need the E, you need the B, you need all of that. So you don't have to have this. This is what we see the most. And that's one of the most cause of high blood pressure. I want to show you something. This is a picture of an artery of a 29-year-old girl who died. We did an autopsy on her. She's having blockage started already in her legs. This also, when I show you real pictures, then you remember it. This right here, 28-year-old male, victim of homicide. Look at his right leg. You see that? 99% blockage. He died. If he didn't die from being killed by a gun, he'd be died from heart attack. You understand or no? Go to the next one. This is the aorta, of the same person. To indicate the red is fatty deposits, homocysteine deposits. But to make the situation a little bit more dramatic, I will show you even the homocysteine deposits inside the arterial wall. You see the crystals? You know, I was talking to my family when we were coming. We were having, some snacks for the kids, and we have some water, something to eat. And I was telling them my experience in life that one time, because he called me, he had a chest pain a couple nights ago, and he's asking me how come I didn't worry about it. I told him, because I'm a doctor, you're not. You know? So he was worried about could be a heart attack. He wanted me to explain everything in medicine. Of course, I didn't. So I told him, if it's serious enough, I would have sent you to the hospital. But I know it is not. So when somebody have arteries like this, we worry about it. One time I was in St. Francis, Good Samaritan Downer Grove in Chicago, an emergency room, do a trauma doctor. And I heard the radio when I was examining a patient talking to the ambulance, saying there's a patient having abdominal pain, and he was in the bathroom and had the severe abdominal pain when he was going to the bathroom. And I was examining the patient. I ran to the radio. I told the girl who's talking, tell him, don't touch him, just wrap his abdomen. Don't waste any time. Bring him over. He might be having a rupture aneurysm. Maybe he have. So I had the whole hospital ready for him. The vascular surgeon was ready. The surgical suite was ready. By the time he came in 10 minutes, we were all ready to take him upstairs. They called me half an hour later that they got it. They put the Teflon around it, and they said it was rupture aneurysm. And it looked like this is what a rupture aneurysm looks like, right there. So this guy is here. Lots of people have that. I check them in my office. People look normal, but we put them through that stress test and the cardiolite and say, hey, you have blockages so much here and here and here and here. We're going to have to change your diet. We have to change everything. When we do, a year later, he's a better person. 5 years later, he's a new person. You follow me or no? This is a picture. This is a real picture right here from that new machine we were talking about we have in the office. These actually pictures, the top one here is a picture of a dog. The dog, the experiment was 1970. We researched on dogs, did research on dogs. We connected the machine to his heart, and the dog had no blockage. 5 arteries, 1, 2, 3, 4, none of them were having a blockage. But we gave them more oxygen, more oxygen, more oxygen to the dog heart for 35 days, 1 hour every day for 35 days, with vitamins and minerals and everything. In white is blood, and that's how much blood he had after 35 days. You follow me? Okay. Now look at the one underneath it. This is real human. His main artery here is 95% blocked. He was going to be taken for surgery. He refused because he heard about that machine from China. You follow me or no? Then he requested it. They told him, you're going to die if you wait. You don't. That machine saves lives. If you're having a heart attack right now, this moment, and you're on the machine, you're never going to die. Why? Because the machine pushes blood back in the heart faster than the heart can push it out, so you have 5 times more blood coming to your heart than the blockage. So this person here, after 35 treatment, had new arteries. 1, 2, 3, 4, 5, 6, 7, 8, 10, 20 arteries after 35 days. This kind of technology we have in the world, and we can reverse things, and we can reverse memory losses, heart attacks, a problem like that. Even there are reports from my clinic. We have the largest center in the world in our office, and Medicare covers it. Some insurance cover it. But it costs $14,000 to get it done. Our cost is $7,000. Some patient will give it to them at our cost. But Medicare patients, most of them need it, and they don't have to pay. So one of the things we have found, if you have good circulation, and you have good nutrition, and you have good hormones, and you have a good exercise, you're going to get better rewards in the end. Are you following me? So what I'm going to do right now, I'm going to put my phone number. So if you need to call me, you call me on my number, 847-571-3914. You got my name, Dr. Nasser, N-A-S-R. Now, you're gonna get me on my cell phone. I'm gonna answer you after 8 o'clock at night, because that's when I answer my messages in the end of the day. Sometimes I have 17 messages, I have 25, sometimes I have 20, but I take it according to priority. I listen to the message first and decide which one deserves to be answered first. Then answer everybody, call from all over the world. I get calls from all over and no charge for that. But if something happened to you, then you did not take care of yourself, nutritionally, or physically, or exam-wise. You understand? And if you went to a doctor and he said you're doing fine, don't believe it. Nobody's doing fine, including myself. Nobody's perfect. Everybody has some problems. And anybody who tell me, yes, you're perfect, so no, nobody's perfect, because we all have problems. So thank you so much, and I'm going to take some questions, and then you're ready going home. We start from front to the back, because the front came first, and the back came last. So yes, I'm going to repeat the questions.
My husband had come with a bypass at 43, and he was on cholesterol drug, but he says I'm also on chassis first injection, regulation, I'm on the Megavard, the CoQ, the Garmin, what, and then aspirin they want him, and I don't know, is it necessary?
I'm going to repeat the question, but I just saw some of my cards here, so I'm going to tell Chris that I'm going to leave them right here. Everybody, one card can pick a card, and I'm going to repeat the question. Her husband is 40-something. 43. He had a quadruple bypass, and then he is on statin drugs. The most dangerous drugs you can take for heart is statin drugs. Okay, because omega-3 will do better job, and B-complex will do a better job than statin drugs. But in any case, his doctor, did not believe in Shackley. And if your husband at 43 had quadruple bypass, I assure you, you know how many miles of arteries we have inside the body? 25,000 miles of arteries we have.
The other one's bad.
What's that?
Other ones are bad.
The other one's going to be having some blockage. The whole issue, when somebody have a problem in one area, believe it or not, you need to take care of the whole body, not just one area. Don't depend on drugs. Go to the nutrition first. Give it a chance.
So he maybe could do it with the nutrition from Shackley?
We don't have a single patient on statin drugs. None. And I've been practiced 40 years. I haven't lost one patient.
Yeah, and then aspirin, they say we have to be on aspirin.
Aspirin, yes. Baby aspirin, we do recommend it nowadays. But with the omega-3 becoming popular, we're right now replacing the omega-3, baby aspirin with omega-3.
So I wonder, it's the same kind of
Yeah.
thing.
Well, baby aspirin is not going to give you any harm, but statin will destroy your liver, heart, and cause cancer. Statin drugs dissolve the muscles. The person himself, your husband, after he took it, his muscles are sore. His muscles wasting. His heart getting smaller, getting weaker. So why use it?
Because you do take on Shackley, hopefully to counteract, but.
Okay, any other questions in the back? We'll take one from the back. Questions in the back? Yes, sir. Yes, ma'am.
I've got a cyst on the liver.
Huh?
I have a question in regards to completely healing the DNA, as you were saying. Do you have, or have you ever known of Down syndrome, which is a...
Down syndrome?
Yeah.
I treated Down syndrome. No, Down syndrome children will not have the syndrome, the 21 syndrome. It could get repaired, but not himself. When we're talking about the repair, we're repairing the product of genetic repair for the person coming out of that person. You follow me or no? Okay. There are two benefits repair DNA. One, the person themselves, they have fibromyalgia or lupus, they can't help themselves. If they are in a major gene, like chromosome 21 or something, or 6, you can't repair. That's the whole chromosome is gone, not gene. The whole thing is gone. So what you do, you can say, yes, if that person ever, like if somebody have diabetes, he's not going to cure that diabetes that way, but he will be improved. But his children will not have diabetes. If somebody has breast cancer, and the sister, everybody has breast cancer, their children don't have to have breast cancer. You understand? Okay. Any other questions? In the back. Yes, sir.
Comment on chelation therapy?
What's that?
Could you comment on chelation therapy?
Chelation therapy? Chelation therapy, we did it 77, 78, 79, and 80. We did about 30,000 of them. Right now we use the methylation, not the chelation, because methylation is specific for a specific problem. In chelation, we used to think deposits of calcium caused everything. You follow me? Now we realize it's not only calcium. We deal with crystals, homocysteine, triglyceride, cholesterol, LDL. So we have to give omega-3, we have to give B-complex, we have to give that. So it's more complicated. And the best chelation therapy you can do is your Shockley program. It's the best way. There's no reason to go have an IV chelation. It's not going to help. But if you have methylation, like my granddaughter read, that is definitely, study has shown it does help. Is that clear?
Yes.
Okay. Any other questions? Yes.
Gestational diabetes, what do you recommend?
That's going to go away after a while. You just have to call me on the phone and we have to discuss that personally. Okay? Yes, ma'am.
If you're taking statin, you stop taking that. How much omega fish oil? How much do you take of that? And I take 3 twice a day, and then for instance, would you take cholesterol regulation complex then too?
It's a general question, really. You have to be specific. Now, if it is the problem of triglycerides, then we're going to say we need to use about 6 to 8 grams of omega-3. If we're dealing with LDL and VLDL, then we're dealing with B-complex, that we need to have about 6 or 8 of that. So cholesterol regulation, it has herbs in it that helps lower the cholesterol. But without B-complex, without omega-3, then you're not going to get all the results.
No, years ago you put Jim on 2 Bs 3 times a day. He's been taking that for 30 years.
That's great. That's great.
So, and you put me on, because my characteristics in the family, you just got to know this. You told me, Mary, you take 800 units of vitamin E if you can afford that. If not, make sure it consists of 400, but take 800 if you can. Lecithin and fish oil. And then, of course, my meal in the morning with no fat, no cholesterol, protein, and other nutrients. But those are the main ones for my heart disease and senile. Guess what? I had a calcium score done and a plaque score done. Heart doctor said 35 years, he's never seen someone in their 60s with a 0 calcium score.
Well,
thank you, Dr. Nassar.
Thank you to you. Thank you, God. Thank you. But this is a good testimony right here from a real patient, a real group, and then it's not she paid me to say this or I paid her to say that. This is real thing that we see in the everyday life. And I didn't get paid to come to you to the lecture because they didn't pay me a penny. I don't get paid to come 4-hour drive. It's my honor that somebody trusts me to take some time off and come and listen to her. So I really want the best for all of you. And if I can be any help, then by all means give me a call. Thank you very much, and you have a good night.